Hi, my name is Ben Atkinson and welcome to the Functional Health Podcast. I interview some of the leading voices in nutrition and lifestyle medicine, and I will share with you their stories, their expertise and their advice, shedding light on the industry from each of their perspectives to help improve your health from today. This week, I'm delighted to share with you my conversation with Dr. Saul Konviser. Saul is a leading dentist with an interest in sports and functional dentistry. And today we talk about ways to improve and maintain your oral health to help improve your overall health. So, without further ado, Saul, welcome to the show.
Thank you very much, Ben. Thanks for having me.
You're so very welcome. I'm actually really excited to have you on. So just to set the scene, you got into dentistry, but what got you into this kind of element of functional dentistry?
Well, I think, just by way of a background quickly, I think it's probably relevant.
Yeah.
Before I did dentistry, I took a bit of a journey to get here, and I did a bachelor's in physiology and then went on to do a master's in health policy or international health policy. And following that, spent some time working with an HIV/AIDS NGO in South Africa. So, and then ultimately into healthcare communications, followed finally by dentistry. And I mean, my dad's an orthodontist, so one would think, why didn't I go straight into it? But I think I needed to find my own journey and work it out for myself, which is, I think, given me probably a greater appreciation as to why I went into the profession and what I want to achieve from the profession, and obviously how I choose to help my patients. And then, when I sort of tie all that together, and as with all of us dentists, we get into it because we want to help people. Mm-hmm. We want to look after their health, and having, I guess, by way of my background, seen quite a diverse sort of areas of healthcare and how everything integrates and comes together, from policy level through to practitioner level, through to communications, through to the impact of industry. I start to sort of look at my approach to dentistry of more, trying to integrate everything more and see how one thing has an impact on another, and taking a more sort of holistic approach, I guess. And it's not just the mouth, it's not just teeth that we're looking at an entire person, an entire patient, and it, things, there's knock-on effects, and we can't disregard that. And I think as the years go by, the evidence base grows, linking oral diseases and oral health with general and systemic health. And that ultimately sort of got me more interested in sort of the functional health medicine approach. It's still new to me in that respect, sort of functional medicine, as it were, but it's certainly a very interesting area, and an area which is rapidly growing and has a very large following. And yeah, that's my sort of background, as it were, and sort of how I got to this point. And in terms of how I see my patients, it's very important that, just from a communication point of view, I always try to emphasize that, it's not just they may come in with a toothache, for example, or they may come in whatever the issue is, but we need to look at the bigger picture. And, it's one thing addressing tooth decay, but actually we need to say, well, how did you end up with the tooth decay in the first place? Okay, is it a diet thing, and then whatever it may be, and looking how it integrates with their general approach to their health and lifestyle.
Yes, absolutely. And that is something I got really interested in a few years back when I came across the work of Weston A. Price. Now, he's someone that I've talked about a bunch of times on the show before, but he was essentially, for people who don't know, a dentist who studied, I think it was 13 indigenous populations across the world, and this was about 60 years ago, something which he couldn't do now. I think it was more than that, actually, probably 80 years ago. And what he found was that in these indigenous populations, they had a reduction in the amount of cavities that they had compared to westernized populations, but also they had very little to no instances of all the risks that we associate with a westernized society. So cancer, heart disease, things of that nature. And that was my first introduction to how dental health was inexplicably linked to your physical health. I'm not sure if I guess you're probably more up to date than I am, again, of the more recent epidemiological data around dental health.
Yeah, I mean, it's actually, there was, I think it was William Hunter, in like the 1900s or thereabouts. He was actually, looking at sort of focal infections of sort of related to oral health, and systemic health and general health. So, way back then, the research was pretty limited and it was very much anecdotal. So it was almost sort of cast aside, but it was generally, that the discussion was started to being raised some time ago. And, it's tying that together of, the oral health and the general health, what is the sort of the causative factors. And, as you said, sort of looking at different societies and indigenous populations, for example, the difference between those societies and Western societies, I think, it's very clear actually when it comes down to, lifestyle, diet, nutrition, things like that. And, when we're talking tooth decay specifically, when we look at different studies, you see sort of rates of tooth decay shoot up and exceptionally high in societies which essentially are having high rates of sugar, and sugar has infiltrated almost every aspect of society. Now, if we were to go back and look at these same populations now as compared to, 50, 60 years ago, where the availability of these sort of sugar-rich, processed, manufactured diets is far more available, I suspect, and certainly there would be a change in their diets, in their dental health. And actually, I do a lot of research, a lot of work with a charity called Dental Wellness Trust, and we focus on child dental health. And we do a lot of work in the UK as well, but in South Africa and in Kenya. And we're seeing rates of tooth decay amongst children under the age of 5 or 7, up to sort of 80%. Yeah, up to sort of 80%. So, in a 5-year-old, that's almost every single one of their tooth has some form of tooth decay. And this is sort of based on a screening. So we're not talking small little lesions which you could pick up on an X-ray. We're talking lesions which you can visibly see just with the naked eye, essentially. Okay, maybe with magnification from a dental perspective, but not, to sort of field screening. So, and we're obviously doing treatment and research in terms of application of different materials to support them. But let's take that 50 years ago where, you maybe wouldn't have had the availability and, of certain fizzy drinks, openly being marketed and sponsoring events or whatever it may be, then the tooth decay rates would have been obviously much lower. Now, overall, as society, I think we are improving our dental health, but there are still many areas. I mean, tooth decay is the most common disease worldwide. I think it's just alarming. And, then you could have say gum disease as well. There's mild gum disease in probably 50 to 60% of the population. 10% thereabouts maybe have more severe gum disease. But from tooth decay, I mean, we're talking billions of people worldwide have tooth decay. And why? Well, okay, is it because they don't brush their teeth? Well, or is it because, they're consuming diets which are, high in sugars and sort of fermentable carbohydrates, as you were, which are sitting on the teeth and
just out of interest. Have you linked certain dietary patterns? Because you mentioned work in the UK, South Africa and Kenya. I'd be interested to see what the dietary patterns are and how that relates to tooth decay in general.
Well, it's interesting because the tooth decay rates in certain parts of the UK are similar to those of people in less developed countries, which you think is quite shocking, actually. There's parts of England where, tooth decay, I do a lot of stuff in the area of Luton and parts of London, and the tooth decay rates of children under the age of 5 or 7 is close to 40%. I mean, that is alarming. And the national average is about 23%, but in certain boroughs, and a lot of it, you can link it to sort of migrant populations. There's a major socioeconomic factors which you can't ignore. You can talk about access to dental services, education, and diet, and those sorts of things. But it is multifactorial sort of dental health, and there's a number of sort of strategies which need to be adopted to address it. For example, we go and run toothbrushing programs in schools, or we do fluoride varnish programs in schools to help improve the oral health of these children. And in South Africa, we've been doing it for about 7 years, and we've seen significant improvements in their dental health. But then there's other strategies and steps which can be taken. For example, they've been doing banning of advertising of these energy drinks, or high sugar drinks on TFL, or the sugar tax, things like that. Demanding reformulation. But again, industry is, will still be able to find ways around it. And although you may reduce the sugar content, you have to also then start looking at behavior change of the individual, and making them make healthier choices to improve their own health.
Absolutely. And I think it's one of those things of balance. Like always, I try not to demonize certain foods, because I think that there is room for almost every single type of food if you just have it occasionally. So a fizzy drink every once in a while, every week even. I mean, I wouldn't necessarily recommend that, but I don't think it's going to have a detrimental impact on dental health if that's the only kind of sugar that you're intaking. However, if it's something that you're doing on a day-to-day basis, there's this bombardment of white refined carbohydrates and sugars, and things that carbohydrates that get stuck in your teeth, and then they're not taking out, and then your tongue-tied salivary amylase can digest that into sugar whilst it's in your mouth, and then it can cause decay, and all these little things seem to add up over time. And it seems like diet seems to be the core problem here, with a lot of or the core underlying problem. When I think toothbrushing, and you mentioned yourself that these interventions do work, but there may be more covering a problem which is ongoing.
Yeah, I think you're absolutely right. It's reducing. We often, as a dentist, I say, it's fine. You can have a chocolate. You can. I mean, I've got kids, 2 kids under, one's 7 and one's 5, and I let them have the chocolate. I think it's important for them to taste these things. You don't want to feel left out, and but it's very much in moderation. I mean, my kids definitely don't have. I personally would not allow them to have fizzy drinks at this stage, because actually we just take the sugar out of it. For example, let's just take a diet fizzy drink, and actually you've then got the acids, the acidity of these drinks. And that's also unbelievably damaging to teeth, particularly baby teeth. You've got, hot lemon water. It's like putting warm acid on your tooth. And over time, I know a lot of people advocate for these things as detoxes, but from a dental perspective, there is clear evidence to show that sort of, constant exposure to these acids on the tooth, especially warm acids, can begin to, weaken the enamel, will make them more susceptible to fractures. Suddenly you get fractures, you've got roughened surfaces there. Bacteria can start to ingress and start to cause things such as tooth decay. So it's multifactorial there. Then you can chuck into the fact, well, actually we're also clenching and grinding while having these high sugar, high acid diets, and we're causing further destruction and breakdown of the teeth, and then, so that you're starting to bring in the stress and the mental health and the psychological aspect of it as well. So like I was actually saying at the very start, when my patients come in and they say, well, I've chipped a tooth. We say, well, I've got a tooth decay. So, well, how have you got the tooth decay? So as you take your history, you realize, well, hold on a second, you've got your tooth decay because you're eating a lot of sugar, but actually you also, having a lot of acidity in your diet, you're also clenching and grinding. As a result, you're breaking your teeth. There's more opportunity for bacteria and sugars to be sitting on the teeth. And actually now we need to start looking at your stress management to help you manage and prevent the grinding and sort of the parafunctional habits, we'd call it. So it's all, by doing a proper history, you realize it's not just about the tooth. It's not just about the dental health. It's taking into consideration the entire patient. And that's, to come back to your question at the very start, my interest in the functional medicine and functional dentistry aspect of it is that's in a way quite a nice example, because it links it, something so serious as mental health, which obviously is going to be a huge fallout of this COVID crisis. I see it in patients from a dental perspective, and it's very, very important to include, to take that wider approach and wider view of the patient, rather just focusing on just teeth. We need to look at sort of how everything integrates.
Yes, no, I completely agree. Just to touch on a point that you mentioned, and I wasn't really sure how it was linked, how does a high acid diet cause things like jaw clenching?
So the diet's not causing the clenching. The diet is the acidity. So let's call it acidity, which is coming from extrinsic sources such as frequently snacking of say citrus fruits, or having these hot lemon or hot fruit teas, which are high in acidity, or diet drinks or fizzy drinks actually of any form. A lot of them have sort of malic acid, citric acid, these things to sort of offset all the sweeteners. So that's sitting on the teeth. And a lot of people, many people have, like you said, a can of whatever it may be once a week. Not really a problem. But lots of people do, sit there and they graze throughout the day, or they sip on their drinks throughout the day, in their office, for example. We all have our go-to, whatever it may be. So now you've got a nice acidity sitting on the enamel, and it begins to soften the enamel and can weaken it and the prisms of the enamel. Then on top of that, let's say, for example, you are particularly stressed, or you have a habit of clenching and grinding. You're sitting at your desk, you're focusing on your computer, whatever it may be, and you've now got this nice softened enamel, and then you're sitting and you're grinding your teeth. Mm-hmm. You can see from a structural point of view, you're grinding away the soft surface of tooth structure, and over time, it doesn't happen overnight. It takes a long time to do, and we obviously have different measurements and things which we take of patients and to assess and monitor these things. But that's how we see it clinically. And there's different patterns. For example, some people brush their teeth exceptionally hard and they cause abrasive cavities. So they physically scrub the tooth structure away and scrub the gum away. Other people clench and grind and they sort of just flatten. Imagine taking a pumice stone and just grinding it on your tooth, and you flatten it away. And other people have, say, just on its own an acid exposure. And that also causes a different pattern. Then on top of that, and this is again, which I find very interesting, and we do pick up in patients, is patients who suffer from gastric reflux, for example. And we look in the patient's mouth and you can see that there is clear patterns of acid reflux, and it hits sort of the certain surfaces of the teeth. And we know that this, chronic gastric reflux has associations with things such as Barrett's esophagus, which of course is a potentially precancerous condition. So, it's important. Again, you can see that that's from a dental perspective. When I look into a patient's mouth, we see, well, actually, hold on a second, you've got this. Have you had a endoscopy? Are you aware of, they suffer from reflux and maybe they've taken, Rennies or something like that, but actually they need to be made aware that there's potentially a wider issue there which needs to be addressed. So, it's important that these things are communicated to patients, that they understand that there is a knock-on effect or what's happening. It's not just their tooth is wearing down from a bit of acidity. There's something going on slightly deeper down and within their systemic and their general health, which should be addressed. And then, and I think by getting patients to understand that and take that on board, I think they also probably take on a little bit more ownership of their own health and their approach to health and looking after themselves. And, certainly from my perspective, if I'm identifying issues such as that with patients, I'd always recommend that they do see a specialist, for example, or they do consult with their GP for second opinions, because while it's not my place to, diagnose, Barrett's esophagus, it is my place to identify disease in the mouth, which could potentially be associated with systemic health and make patients aware of that.
Yeah, and I think what you just outlined there is extremely important. We always talk about certain diseases and conditions being multifactorial, and outlined from me just counting on my hand 5 different things in terms of diet, brushing, grinding your teeth, acid in terms of like those lemon, and I suppose apple cider vinegar is really popular now, which can just put the acid directly onto the teeth, and even GERD. Something which you wouldn't really think about. And those 5 elements, maybe one of them might be tolerable for your enamel and your tooth, but put them together, that's going to cause real decay very, very quickly. And I think when you explain that to patients, it must be like quite eye-opening, but it's not just one element which causes tooth decay. It's many, or it can be many.
Yeah, I mean, absolutely. And I certainly with my approach to patients is to try and make them understand that it's like I've been saying kind of a few points throughout this, is we need to take an integrated approach of our oral health with our general health. And it's not, things don't really, okay, let's take one case of a trauma, for example, out of it. You get the hits in the tooth and the tooth breaks, and that's okay. But let's just talk about the general health of, dental decay, gum disease, the impact that this has. And I take photos of patients' teeth. I show them their x-rays, because once they physically see what's going on in their mouth, you can relate this to your health. And it's all, it's very well me saying to a patient, okay, well, you've got, a cavity on this tooth caused by this, and it doesn't really mean anything to a lot of people when you just list off terms and give them facts. But I find visually showing them, and you can almost see patients creating the picture in their mind of how things link together. And I think it's really important, and it sort of reinforces my approach to this. And I think, and sort of obviously, as dentists, this is how we are sort of trained to approach patients and communicate with them. Mm-hmm. And I just think it's very important I think it's important that patients begin to put the two together. So to put the mouth and your oral health, not to isolate it from everything else. And I think historically that's what's been done. And over time, and with the advent of more research and evidence and, changing lifestyles. And I think that's becoming slowly, but people are more aware. I think it's driven from a few different angles. I think it's driven from the scientific research point of view. I think it's driven from the clinical point of view, us, encouraging patients to understand. I think, it's also driven from, you have the lifestyle influence, society's sort of driving factor. Now, maybe the intentions of some of these things are not necessarily for health. Maybe they're for cosmetics and aesthetics, but ultimately, it can tie in, patients wanting to look at dental health and things to look better, and maybe going down whitening or veneers, whatever it may be. But how maintenance of how maintaining the good aesthetic in patients' mouths, they need to take on board the other issues as well, if that makes sense. That's come across correctly.
Yeah, I think it has, absolutely. And even there's a functional element to that as well. And I know we talked off camera, off the podcast before, about how there's certain diseases which are linked to your oral health. And I wonder if we can just dive into some of those now.
I think from oral health and those issues related to sort of oral disease, related to general systemic health and systemic disease, it's such an interesting area, and it's something which I certainly discuss at length with a lot of patients. Now, I think with a lot of this, we need to take is it association or is it causation, really? I think from the start, we need to be looking at that. There's obviously many confounders in all of the research, and are patients more susceptible to certain things before we've even started looking at the research? But there certainly are strong associations with a few issues such as periodontal disease and cardiovascular disease and diabetes, so type 2 diabetes, but in particular. And I think to try to sort of break it down a little bit, if we look at your mouth and, the thousands of microorganisms which are in there at one point, and then we look at, let's say, focus it down to periodontal disease, and you have, sort of thousands of microorganisms sitting in underneath the gum, slowly sort of destroying the bone, the structures surrounding a tooth. So we're talking here of gum disease, so mild or severe gum disease. And it's essentially a chronic inflammatory state which is going on in the mouth. Now, you have, you said, the causes. Well, what are the mechanisms by which this may be linked to our general health? Well, we've got a direct mechanism, for example. I know this has been talked about many times. And, is the microorganisms which are sitting there in these, what we call like a periodontal pocket. So the gap between that has been created between the tooth and the supporting structures, where you have the bacteria sitting there and multiplying and slowly destroying the structures. Is that causing the problems systemically? So, these bacteria have been found at the sites, for example, in thrombi, so suggesting, well, does it have a role to play, a direct role, the bacteria itself? Again, this brings us back to that original comment which we were both talking about, was, Hunter's postulation of, focal infection as it relates to oral health. Then we can talk about the other mechanism, or the sort of the indirect mechanism, and that is the chronic inflammation which is going on as a result of the chronic gum disease, and your chronic inflammatory markers, your cytokines, your CRP levels have gone up, as we know, as an indicator for systemic inflammation. And those is the chronic inflammation more related to the chronic illnesses such as cardiovascular disease, diabetes, rheumatoid arthritis, the more chronic inflammatory health issues. And I think it's certainly for cardiovascular disease, diabetes, and rheumatoid, there's certainly much more association there. There is, I'd say, sort of less, not as strong evidence, but certainly by association, with respiratory disease, a number of other factors, kidney function, starting to come to play in terms of the availability, like the research which is available. And this is down to, what's going on in the mouth. I know there was a sort of consensus, the Society of Periodontology, I think it was in 2013, there was the consensus and agreed what I've just said actually about cardiovascular and diabetes and the association with severe periodontitis. And actually, when we're looking at the management of patients with severe periodontitis, so they've gone under periodontal therapy, for example, and when we've gone back and looked at, say, their glycemic index, it's improved after treatment. And when we look at their CRP levels, they've reduced as a result of periodontal therapy. So
what does that entail exactly if you're reducing CRP? Because that's a systemic inflammatory marker.
If we are treating, let's say a patient comes in and they've got severe periodontal disease with chronic inflammation in their mouth, with, huge, deep pockets, and the bacterial load is exceptionally high. And this is sort of, if you want to look at it, almost sort of micro bacteremia is continuously being exposed, continually happening, but also chronic inflammatory markers circulating around the body. So if we're able to treat and manage the gum health and reduce the bacterial load and reduce the chronic inflammation within the mouth, it's suggestive that this is associated with your general inflammation and systemic inflammation. So, does that have an impact on your general health? And that's what we're saying, and that's what the research is, like we've said, associated with particularly cardiovascular and diabetes. And it's so important to get patients to understand that, it does appear that there is a link, okay? And by ignoring it, by just isolating the mouth and not tying it together with the rest of the body, it's potentially putting patients at greater risk. And now, like I said at the very start, there are, patients likely to have been at risk beforehand, and there's a number of confounders and things like that. And, are they smokers as well? And, all those sorts of issues. So, they're more likely to be susceptible to these things anyway. But nevertheless, I think we need to acknowledge that it's incredibly important to put our oral health as part of our general health when we are approaching and looking at patients.
Yeah, I mean, it's absolutely fascinating. I guess one of the questions, because this is a topic which I'm not really familiar with, is the kind of the outcome in the mouth, this buildup of bacteria in the mouth, a problem which is related, or I guess which came first, the chicken or the egg, right? Is the problem in the mouth related to what's happening internally inside the body, and then it's manifested in the mouth, of which you can actually see and test for? Or is it the opposite way around, that something's happened in the mouth, this buildup of bacteria, this periodontal disease, which is causing an internal and systemic problem? Do you have any idea on that one?
Yeah, I mean, it's difficult. And, as the years go by and we get more and more research to, provide a causative link, then, it'd be, you wouldn't want to absolutely, say for sure at this point, but there's certainly by association a good indication that what is going on in the mouth does seem to be having an impact on our systemic health. And finally, actually recently, just before, not long before we sort of went into lockdown, she had a patient recently, and she'd had a number of health issues, and in her 80s, and hadn't seen her for a little while. And she came in saying she'd been feeling unwell, and her doctor couldn't find the source of infection, but her inflammatory markers were up. Certainly there was, she was unwell for some reason. And we looked in her mouth, and her mouth really was not in a great state. And there was a couple of broken teeth, and there was a dental abscess, and there was some gum disease. And we treated that. And, she went over a matter of months. She had been back to the GP, and things had improved. Now, I'm not saying that is a direct, I resolved the issues for her as a result of dental, but it suggested that her mouth was really in quite a poor state. Was this, having an impact? But having said that, like I said, she had a number of other health ailments as well. So it's certainly interesting, and it's certainly important for patients to, not just say, well, okay, I've got gum disease, and just, my gums are bleeding. Let's just quickly go and get them cleaned, and I'll be fine. And then I'll come back and see my dentist a year later. But actually, we need patients to say, well, it's not just a quick fix. We need to take ownership of your health. Be it gum disease, be it just a chronic dental abscess as a result of patients just putting off having treatment. You've got to infections sitting underneath the tooth, and often patients come in, they just want to have antibiotics just to calm things down, but it's not eliminating the infection. It's not eliminating the source of the infection. You just have this chronic inflammation and chronic infection sitting there in the mouth, and you get sort of, bacterial metastases, as it were, if you want to look at it from that perspective. It's sitting in the mouth, and is this bacteria going to float off the rest of the body, and the inflammatory marker is going to, be a sign that there's further issues to come. And it's really crucial that patients, don't try and, I guess, sort of look for a quick fix and think things will be resolved straight away, and it's not going to have an impact, and the rest of their bodies and health is going to be fine. It's really important that they, do take a more integrated approach and understanding. Yeah, and a holistic approach. Yeah, and a holistic understanding of how things fit together. And, like I said, we often get patients who want to come in, do something quickly, fix it and move on, and then we see them 5 years later, and they come back 5 years later and things have fallen apart again. Because the fundamental problems haven't been addressed.
Exactly. And we always talk about in functional medicine, like getting to the root cause of the problem. And just because, okay, we fix something, everything's okay right now, but if you don't correct that underlying issue, whether it be poor diet, teeth grinding, heavy brushing, acid, GERD, whatever it is, those issues are going to come back. And I think that's hugely important. You've outlined them extremely well there. And I think what you've also... what seems to be reaffirmed in my mind is that there's an interconnectivity between what's going on in your systemic system in terms of health and what's going on in your mouth. And I guess we know this now in terms of the foods that we eat can influence our gut microbiome, and also the foods that we eat can influence our oral microbiome, and whether that's actually reflected elsewhere is also extremely fascinating. I'd be interested to see whether dental health is also linked to many other diseases that maybe haven't been tracked before, even cancers, for example, or certainly hypertension and things like that. I mean, I spoke to you just before the podcast about a study which I've read, which I've not managed to go into, about mouthwash potentially knocking out some of the nitrite reductase enzymes in the mouth, reducing nitric oxide to be produced in the body. And we know nitric oxide is essential for vasodilation of arteries, and that is potentially linked to hypertension. However, there's not really been an interventional trial to prove that, but I think that's hugely interesting as well. I know we spoke just before the podcast about how potentially your mental health can have a detrimental impact on your oral health. What did you mean by that?
Well, I think there's a few ways to look at it. I think firstly, we should look at, from a cognitive function point of view. There was actually an interesting study done, and it's looking at sort of the cognitive function and how that is impacting sort of periodontal status and in patients with Alzheimer's, in fact. And as sort of cognitive function decreases, or as age increases, their rate of periodontal disease appears to be worsening. And is that because they are, these patients or individuals are unable to process, and physically brush their teeth from a dexterity point of view, but also from a memory point of view. I see patients who, do struggle to maintain these daily routines and need further support. And as a result, you end up with a number of issues with their oral health. And we know that particularly in care homes and care facilities, this is a major issue. There's a large focus in care homes from the CQC with regards to oral health, because, you can imagine that these individuals are physically unable to maintain their dental health, and, be it just dentures, for example, or their actual own teeth. They can all harbor bacteria, but also the actual know-how to do it themselves. So there's sort of the mental health aspects in that respect from the elderly, but I think there's also, I find it quite interesting when we look at younger generation, actually, kind of touched on it very briefly before from the aesthetic point of view, but sort of the influence of modern day society and pressures on individuals to sort of attain a certain body image and social media influences and all of this stuff. And, that the stress that can put on an individual's mental health and how that can tie into their dental health. So, the pressures to look a certain way, or your teeth to look a certain way, let's say from a weight perspective, for argument's sake. Okay, so more patients, there's people who may suffer from, say, eating disorders as a result. And we touched on it before from gastric acids, that can have a devastating impact on their teeth. Let's talk about the pressures for the teeth to look a certain way. So people want to, constantly obsessed with their, looking white or having veneers, and you going down the issues there of sort of body dysmorphia issues. So there's the mental health issues there. And these are all things from my perspective, which, it's important that we discuss these issues with patients, because it has a direct impact on their dental health. A patient constantly wanting to do, never happy with the appearance of their teeth and constantly wanting to do things can actually be very, very destructive. And it's our role to put our patients' health and interests first, patients before profits, as it were, in a sort of crude way, as a term which has been heard before. But, and it's important that you factor in these other issues and how that has an impact on individuals' oral and dental health. And then you could go right down to sort of child health, which kind of brings us right back to where we started at the very beginning in terms of child dental health. If a child, and this is a lot of the stuff I do at the charity, our approach is, I see, general health through dental health, and particularly from a child perspective. I often hear from parents saying, well, it's not a problem. It's just their baby tooth. It's not a problem if you have to extract that tooth, or they had an abscess in that tooth. The adult tooth will come through. But actually, it's very frustrating when parents say that, because, if you are a child who's 4, 5, 6, whatever it may be, and having to have your teeth taken out, you have a major potential knock-on effect from a psychological point of view. So, the 4-year-old has to have a general anesthetic. They are maybe being teased by their friends and their classmates for having decayed teeth, missing teeth, whatever it may be. They no longer want to smile. Suddenly a child as young as 4, 5, whatever it may be, is lacking confidence to do what every child should just be doing freely, and smiling and talking and having fun. It has a knock-on effect. And, I see it in patients who come in, and young patients particularly, and how that's, you can see sort of that they're just conscious of it. And then that slowly over time manifests as they get older. They become more self-aware, more self-conscious of their smile. And, maybe they're lacking confidence, and they no longer want to, go out or speak with friends, and when you look at it from that perspective, it really does have quite a major impact, on a mental health, perspective. And so again, that's, from so many different angles and so many different perspectives, the maintaining your mouth and your oral health, is so crucial to one's general health and well-being, not just from the physical, but from the mental, from the emotional points of view as well.
Yeah, absolutely. And what you just said there about like the child not wanting to smile, for example, is something which I've never really thought about before. But you're right, kids can be cruel sometimes, and they can just say something which maybe might be taken the wrong way by the child, and therefore they don't want to smile. And we know that smiling, even when you don't feel happy, can increase those kinds of feel-good hormones in your body to actually make you feel happy overall. But when you don't want to smile and you're reducing your kind of interaction that way, I imagine that's damaging on a level which maybe we can't really comprehend or measure yet. So that's hugely interesting, and I completely agree with you there.
Yeah, it is. It's almost, that's, I guess, sort of why I have a sort of very big interest in the sort of the public health side, as you can obviously imagine, and also with kids myself, I guess, I look at it, probably have a a very sort of personal approach to that in that respect. And that's why I think, it's not just, we all have a role to play. And I think, doing things such as this with yourself, podcasts and, helping sort of to educate people on different topics and then, in sort of classrooms and, from a, industry level, from a policy level, I think all of these things can ultimately have a positive impact and make changes for the benefit of people's general health and well-being. But it's difficult, it's a long journey and there's lots of steps and, all of those things, and you need buy-in from everybody and it's possible to do, but, all the cliches, as it were, steps, baby steps, but, I definitely think if we sort of put our patients' health as sort of priorities and as a priority and put it first, I definitely think we should start to get more of that integrated healthcare approach. Doctors and dentists and nutritionists and all, whoever it may be, and physios and everybody talking to each other and realizing that it's not, we shouldn't be so siloed. We should communicate more as a profession, because ultimately, it's for the benefit of our patients.
Preach. I couldn't agree with you more there. That's something I bash on about all the time, is that the integration of health professionals, is so important to the benefit of patient care. And you've reaffirmed that and articulated that so beautifully there. Something which I wanted to ask you about, or actually everyone's probably wondering, so what can people do to optimize their oral health? And then we all go to the dentist, they say you need to brush, etc. But how many times do you need to brush, for how long for, with what kind of toothpaste, and should we floss every day? Should we not? Should we always use mouthwash? Can you give us just some quick tips in terms of something which some people might find boring and samey, but I'm still interested in what you have to say with this one?
Sure. So from a practical point of view, so always brush your teeth twice a day and try to be doing that for 2 minutes using a fluoride-based toothpaste. And you should always spit, don't rinse, because we would like the fluoride to stay on the teeth and keep the teeth nice and healthy. And the same applies for children. The fluoride content for children's toothpaste differs, and so does in toothpaste, which you put on their paste. But in a practical point of view, if your child has 2 teeth, you're going to brush their teeth for 10 seconds. So I generally say 3 to 5 seconds per tooth. For children, I generally say make sure you are brushing their teeth every morning after breakfast, before they leave the house for school. Obviously, during COVID, that's not practical, but after breakfast and last thing at night before bed. So they're not having sugars sitting on their teeth as they go to school, because there's sugars in all sorts of food and cereal, and they're not having sugars before bed. I definitely encourage patients to try to be flossing or using interdental brushes, ideally every day, but I realize the practicalities of it are that most people won't be doing that. So I always say, while we'd love you to do it 7 times a day, aim for 5. Realistically, you'll probably do it 2 to 3. And then from there, you'll gradually, it's very difficult to create new routine. And I think if you make it an achievable target, it's much easier for patients. It's more realistic. There's no point giving patients unrealistic expectations, because they'll just give up straight away. So, I say 1 to 2, maybe 3 times a week if you can, then you'll begin to realize the benefits of it. Or I sometimes say to patients, do you know what? We've done a clean, here are the issues, really go for it every single day. And, using floss to clean in between the teeth where a brush can't get it, using those little interdental brushes to clean at the gum line. And after about a week, you'll realize, oh God, this feels really nice. And you'll want to continue. So, people's brains work differently and they're motivated by different things, and it's playing into the psyche of individuals and what works best for them. Diet, from a diet perspective, certainly, like you said at the very start, people, it's okay to have these things, in moderation. But I think reducing the frequency at which our mouths and our teeth are exposed to things such as sugars and acidity, rather than snacking it constantly throughout the day, keep it to your meal times, and your in between meals should be something which is sugar free. Swapping a sugar for a xylitol, for example. Of course, there's also the smoking issue, which obviously I'm an anti-smoker. I'm also an anti-vapor. I think I find it very worrying that vaping is so publicly marketed, even in things such as pharmacies. I know it's been very effective in helping people reduce how much smoking they're doing, but at the same time, people tend to be vaping more frequently than they would be having a cigarette. So cumulatively, you actually have your contact time is much higher than if you were having 2 to 3 cigarettes a day. It's more socially acceptable to sit there on a vape wherever it may be constantly. And don't forget, there's still nicotine in there. You still got essentially heat being exposed to the soft tissues, which can cause cellular change and potential long-term problems, of which, of course, the research is very limited in terms of that at the moment. And finally, just from a practical tip, making sure you are going to your dentist regularly. Don't leave it till last minute problems. Prevention is always better than cure. That is hopefully will help patients put them in their mouths in good stead for the future.
Brilliant. And something which I actually found really useful and I think it was introduced to me by Tim Ferriss, who I watch and read his blogs occasionally. He was like, because he hates flossing, I think he said to floss, he set himself out to floss 2 teeth every single night. So it's only 2 teeth. But the fact is, when you've started flossing, you're more likely to finish your entire mouth. But you set yourself a goal of 2 teeth. So if you just manage 2 teeth, then you've completed your task. But I promise you, and I started this, I floss nearly every day now, or every day, primarily just because I know if I really don't feel like it, I only need to floss 2 teeth. And that has been a really helpful tip for me, which sounds daft, but in terms of longevity of me doing something, it's probably been the most successful intervention I've had.
To be honest, I don't think it's daft. I actually think it's quite clever, because it's sort of psychology there, isn't it? Really, you give a easy, achievable task and objective for people to sort of strive for, and you think, oh great, well I've done 2. Let me try another 2, and let me add another 2, and then solely the motivation behind it is patients feel rewarded because they've managed to get through smaller tasks, and ultimately, it's towards the bigger goal of ultimately flossing the entire mouth. And I think we're all different. We all have different, motivations and different ways and things that we respond to from a psychological point of view. And what works for you doesn't work for somebody else, and etc. And I think, I think just being realistic. There's no point, like I said, there's no point a patient coming in and me saying to them, right, you have to floss 7 days a week. It's not going to happen. So yeah, listen, if it works for you to start with 2 teeth a day and then build up from there, then I would, happily support that.
Yeah, and when you said from a psychological element, I know Dr. Rangan Chatterjee bought his book out. I think it's Feel Better in 5, or I might be screwing up the title. Either way, I'll link to it in the show notes for listeners. But essentially, his idea was like it's just 5 minutes a day, or 5-minute habits every single day, and you'll gradually build up to better your health. And what he's found is that in terms of clinically, when he says, just exercise 5 minutes a day, which is something very, very doable, people tend to do more because they've set out to do 5 minutes. But once they've done 5 minutes, they actually want to do that little bit extra. So that psychological element really, I think, interplays with multiple different facets of your lifestyle, or aspects of your lifestyle, I should say.
Yeah, definitely. And I think, just from like an exercise point of view, that's, especially let's talk about now, even just sort of during lockdown. Obviously, you want to do all this exercise while we can, if we've got the time to do it anyway. And I haven't done any exercise for a little while. I've been unwell and I had an injury. I thought, okay, well, there's no point in me going straight into running a 10K. I started off, I went for like a 10-15 minute jog, and each run, I just added 5 minutes on top of it, because I knew I could achieve another 5 minutes. There's no point in me adding another half an hour. And then obviously now I'm back up to sort of the fitness levels where I wanted to be. So yeah, it's it's setting ourselves achievable tasks. And just to actually come back to that, for example, we're talking about diet. It's all very well patients coming into me and they've got mouths full of decay because they're consuming these diets. It's all very well me saying, right, well, don't have this drink or don't have this anymore. But we need to make it realistic. We need to find them an alternative. You need to plan out a diet diary with them. It's all very well just giving someone an order, but if you don't have something for them to switch to, so that's why people have got onto vapes, because it's the alternative to smoking. And it's easier for them to maybe cut down that way. To say, well, don't have cans of Coke anymore, or maybe we can say to patients, okay, move on to sparkling water, for example. And then if you want that sort of fizzy hit, a lot of people, when they have their fizzy drinks, they like that hit of like the sensation. So, the psychology is so interesting and so important, to helping people make lifestyle changes. And, it's absolutely not to be disregarded. And I think that's sort of ultimately sort of underlines everything which we've been discussing today, getting patients to understand and to take on board, and make those changes in their life, which will ultimately impact the rest of their health.
Yeah, absolutely. And I'm just going to, I know we're coming up on time, so I'm just going to quickly go into the last 3 questions I ask everyone on the show. With the first one being, what is the most impactful change that you have made in your life and why?
Well, as I said at the start, I've done quite a few different things. Impactful in different ways. One is actually finally embarking on a profession in dentistry. Has made a major change to my life from just a job satisfaction point of view. I'm extremely happy with what I do and where I am in that respect professionally. I think sort of doing from a personal perspective, just trying to do more exercise and keeping healthy in that respect, just to generally feel better, more energy, and from that side of things, definitely.
Perfect. And then secondly, how can healthcare become more integrated with the kind of interventions, I guess, around functional dentistry that you've outlined today?
Well, I think, like I was saying, I sort of said towards the end was, I think just stop all of us being so siloed, and much better communication and integration between the different healthcare professions. And, I think that will ultimately, a more collaborative approach will ultimately help bring, shed light, find further evidence to support our patients and look after their health.
Brilliant. And then the last but not least, can you please provide the listeners with 3 tips? And like I say this all the time, but I know you've provided many already, especially with the practical elements, but 3 tips to help improve their health and well-being from today.
I think stress management is crucial. I think that has a major impact on pretty much every aspect of our lives. I think, yes, absolutely stress management. I think diet, again, as we've discussed at length today, also has a huge impact on our health and well-being. And I think communication, and I think that communication ties very closely with stress management, because it can, communication with our loved ones, our friends, our family, our colleagues, our patients, it really is incredibly powerful and can have such a positive impact on what we do and how we live our lives.
Perfect. Saul, it's been an absolute pleasure to have you on the show. I've found this podcast extremely interesting and this conversation extremely interesting. But before you go, can you please tell the listeners where they can find you and what exciting projects you have coming up?
Cool. So I work at Montagu Dental. It's a dental practice just on Montagu Mansions, 47 Montagu Mansions in Marylebone, just off Baker Street. And my exciting projects, I'm doing a lot of work in the area of sports dentistry, looking at the impact of oral health and sporting performance in amateur, professional and elite athletes. And that's one to keep an eye out for. That's what I'm involved in at the moment.
Brilliant. Well, Saul, it's been an absolute pleasure to speak to you. I've certainly learnt a lot, and I do hope that we can do this again soon.
Thank you very much for having me. I've really enjoyed it. It's been great. Thank
you. Thank you for listening to the Functional Health Podcast. You can find links to everything that we talked about today in the show notes. If you have a second, please consider leaving a 5-star rating on iTunes. It really does make a huge difference and helps get this valuable information out and reach more people. Don't forget to subscribe so you can stay up to date and know whenever I release a new episode. You can connect with us on Instagram, Facebook, or our website, and all questions are welcome. As always, thanks to Josh Aurelia for the editing and Alan Harper for his support.